I must thank everyone, particularly our speakers, for attending with us today. This is a very important webinar, and I truly appreciate your participation. I would like to open our webinar by acknowledging that we are on the traditional territories of the many First Nations, Métis, Inuit, whose footsteps have marked these lands for centuries. An important step in reconciliation is our acknowledgement of traditional land. The Coalition for Canadian Police Reform, as you all know, is a national nonprofit corporation with one primary vision: to elevate the police profession in Canada. Our mission is to see the creation of a national centre of policing excellence, uniquely designed for Canada and established by a special act of Parliament. The centre would be responsible for the development of national, current, and relevant training and education standards for all entry-level police officers. The centre would also be a central repository for best practices and create a national certification protocol that administered by the provinces. In support of our mission today, our webinar is intended to inform participants of the complexities of privacy legislation and its impact on policing. I've said repeatedly that information is the lifeblood of policing. Every police officer in Canada deserves to have the benefit of critical thinking skills and current knowledge in order to face the challenges of our complex and diverse 21st century social issues. And there are many, and they are growing. Before I introduce our moderator today, I must express my personal appreciation on behalf of the Coalition to Andy Horn and SIMSI for sponsoring our webinar today. Andy, thank you, and believe me, we do appreciate it. I am particularly pleased today to introduce our moderator, Chief Rich Johnson of the Barrie Police Service. Chief Johnson has served 28 years, including assignments in both operations and administration. Rich holds a Bachelor of Arts degrees from Queen's University, a Master's in Leadership Studies from the University of Guelph, and a Master's degree in Applied Criminology and Police Management from Cambridge University in the United Kingdom. We all know that he is deeply committed to evidence-based policing. Chief Johnson also serves as on our board of directors, and we are particularly pleased to have him with us and to provide us with advice and guidance as we move our mission forward. Chief Johnson has agreed to moderate, of course, and introduce our speakers. Chief Johnson, thank you for being with us today, and I think I'll just turn it over to you. Chief?
Thank you, David, and welcome everybody. I'm sure we're all excited to get going here. I was going to provide some introductory remarks regarding privacy and the challenges that law enforcement or public safety faces on a daily basis, trying to provide public safety to a community, but at the same time trying to balance the need and respect for privacy of every single Canadian citizen. Our speakers today are far more interesting and have far more insightful thoughts to share. So I'm going to jump right over to them. Before I do that, though, what we do know about human learning is that stories are the best way to convey meaning. And so I'm just going to tell you a very quick one. On occasion, we send our members to conferences, generally in Ontario, where Barrie is, sometimes across Canada, and infrequently we'll look elsewhere. And on one occasion, we had the ability to send some people down to the American Society of Evidence-Based Policing. Excellent conference, great material. I brought down our crime analyst as well as a number of other members, and they have different streams. She happened to attend one particular discussion, and I wasn't able to go to that one. It was back in Barrie when I was informed of the content of what she had watched. And it was actually, and Andy will appreciate, it was a SIMSI presentation on what they call DICE, and that's the Data-Informed Community Engagement. And basically a system where it's not just police-specific. Policing and public safety in Canada face complex challenges, and we do know that one thing is for sure: there are no simple solutions to those, and it requires an intersection of so many different groups within society, nonprofit, other social agencies to come together to try to drive change and to come to moving that ball forward to have some impact. Very excited to have seen this. I excitedly chased this down. We are in Barrie, we actually do use SIMSI, and with risk terrain modeling, a research-based approach to targeting hotspots, among other things. And we faced an immediate challenge with DICE, and I'm sure our next speaker will speak to that very colorfully, because what is required with DICE is, because it's data-informed community engagement, it requires a number of things. Data from a number of sources, and community engagement, certainly from different agencies, nonprofits, but also social agencies, and a willingness to share data to make change and positive change with the purest of intent. I'll stop there because I have no doubt our next speaker will maybe just touch on that. So I'm pleased to introduce Andy Horn. Andy is an experienced public safety professional with a bachelor's in criminal justice and criminology and a master's from the University of Texas at Dallas. As a former police commander with Carrollton, Texas Police Department and a current reserve deputy sheriff for the Torrance County Sheriff's Office, Andy brings practical law enforcement expertise. After a career shift to becoming the Director of Information Technology for the City of Carrollton, Andy has worked in public safety technology since 2019. In the private sector, Andy has managed privacy and security concerns across multiple countries. Andy is committed to balancing technology solutions with the protection of privacy to create safe spaces in communities. Andy, good to see you again. I'll hand it right over to you. I'm excited to hear what you have to say. Get it started, please.
The only problem there is you said I'd be more interesting than you, and that's definitely not going to be true. So, we're very pleased to sponsor this webinar, and I think because the subject is very near and dear to my heart, having gone all the way back from being what we call our criminal agency coordinator in Carrollton, which is basically our version of CGIS and our version of inlets and TLETs, the person responsible for all that security, to then taking over the role of the IT director for the entire community, and doing that through a ransomware attack where we lost everything in our city. Did it through COVID-19, and then moved into the private sector, where I've been really fortunate to work in multiple countries and thus dealing with the concerns for privacy and security in multiple countries. And that is what kind of has brought this up to kind of our attention. It was a really good conversation we had with the people from the coalition and brought us here today, because I think it was, I, as an outsider looking in, and as you may pick up my y'alls and howdies, I'm definitely an outsider to Canada. You see the strengths and the weaknesses. So in the United States, we are very legislative in regard to our privacy and our security concerns, as in it's very clear this is the law, you can and can't do this. And in some respects, you might find some of them are very complex and some are very simple. Our ability to access CGIS data, or our equivalent of anything that would fall under kind of the protected types of data in Canada, is a pretty simple law, and the standards, whether or not you would consider them high, there's no complexity in how to achieve them. And working in the UK, we found a very unique perspective where this is with a prior company, but I was one of the first people going there and trying to achieve their vetted status, which is essentially the ability to view private and secure police data as an American. And that is entirely based off background checks and history checks and whatnot of systems in the United Kingdom, of which I don't exist. So we had to go through a kind of as you in-flight process of trying to say, are we legitimate people, and do we have the background that a outside look would then allow someone to affirm as being okay for their security standards. And then working in Canada, which has been an experience, not just from the DICE side, but even from the policing side and the government side. In the United Kingdom, you have police are pretty much separate from their local government, local council, local authority. In the United States, they are almost always a part of that local authority. In Canada, you have it both ways, depending on the environment. And it kind of like your laws are kind of both ways too, as an outsider. So the reason why, from a supplier's perspective, I think this is important is if you look at what technology and what solutions are available to you to do the work that you need to do, when you have laws or regulations or policies that are either unclear, up for interpretation, or just a very, very high bar, that also means you could potentially lose out on technologies that are very advantageous to you. If you look at the CAD and RMS space in Canadian policing, you only really have a few players, maybe a handful, less than 10. And in England, it's even fewer, but in the United States, you have tens, if not 100. I'm not saying that's the best solution, but it does breed solutions that can be best fit for what you need. So that's kind of the tone that I kind of wanted to set, and I think we all agreed on, is that, you know, as a supplier, it's interesting to be on the outside looking in and see how Chief Johnson can have a really good relationship internally, a little bit of complexity dealing with other external resources, which is a lot of what we focus on from our stuff, to other cities or police services we've worked with who have very strict rules of, yes, I can't share data with my neighbor or even the agency I used to work for now. And then that has prevented them from having effective crime prevention, problem prevention, community safety and wellbeing programs. So that said, again, other people here are more interested than I am, so I will pause and we can go on to our next speaker.
Thanks, Andy, and appreciating the Canadian context. It's just a little different. Certainly, with the federal, the overseeing body, but it's at the provincial level where the policing is delivered, and so each province necessarily has a different setup, which makes everything so wonderfully simple, except not. So not ideal. Before I go on, and John, you'll correct me, we are going to take questions at the very end or after each speaker before I get on to Jared.
You do it either way, typically at the end. But if there's a really prime question, stick it in.
I just looked at the messages there and I didn't see any. So I'm going to continue on, and I'm going to introduce Jared Bilby. And Jared, I apologize on the pronunciation of your last name, so please correct me. Let me go right here. Hang on here. I have your write-up. I don't want to mess this up. So, because this is impressive. Jared is an established data and AI ethicist, professionally trained in the field of information ethics. He has written, published, and edited extensively in the field. He has collaborated and advised on ethics best practices in technology, information, and data use for over a decade. As a consultant, Jared has managed international teams on the creation of AI ethics standards and methodologies. He currently holds the Data and Analytics Ethics Advisor role for the City of Edmonton, Alberta. That is incredibly impressive. And so, Jared, I'm going to hand it over to you and hear what you have to say on this.
Thank you, Chief Johnson. I'm just going to jump right into it. And before actually, sorry, I can't advance it. Do I have the co-host power, John? Oh, you're on mute, John. Oh, okay, I've got it. I think, no, that's just the Zoom. John, you had it up earlier.
I apologize, Jared. I think John's going to have to push them forward for you if he's able to. I mean,
Sure.
That's not ideal, but we'll. John, are you able to do that on his behalf? And you're on mute, John.
Yeah, certainly. I'm on slide 1 there. Is that what you want, Jared?
Yeah, perfect. So yeah, I'll just cue next slide when I'm ready. So actually, next slide, we'll start here with the definition of where I'm coming from. I'll just give a quick overview of kind of my stance on the wider issues here. I've been looking at that crossroads of access to information and privacy legislation for a long time with what I do, and I think I can echo what Chief Johnson was saying, that it only gets more and more complicated, and especially as we go into AI. AI is the big disruptor, and I think over the next couple of years we're going to see a number of new questions we've never even considered, and maybe a back and forth in best practices and what directions to take. But from my perspective, what I try to do is, it doesn't matter what the issue is or the technology, because those will always advance, those will always change, there will always be a new technology. I used to try to kind of present along the lines of best practices in using AI and data, but even that itself is becoming complex. And so what's happened for me over the last couple of years is that I've come to teach from an education perspective, basically an awareness perspective in terms of critical thinking, because at the end of the day, each and every one of us have to have the critical thinking skills to navigate these questions and scenarios, and especially in police work, on the spot, in the moment. Sometimes, we don't have the available resources, and we have to rely on our own critical intelligence and ability, and that's what needs to be honed. And so that's what I try to aim for now with my work. And so at the bottom line, data ethics, as the definition says here, it's basically an equitable use of data. So from gathering to application, a data ethicist tries to navigate that gray space between legislation and morals. Otherwise, where morals, the word morals came from ancient Greek mores, which just means common norms. Everything that the public kind of takes for granted, our common morality, expectations, and so forth. So ethics. Next slide, actually. And next slide after that. Ethics is kind of a middle ground between social norms and legislation or law, which social norms is always changing and legislation is very, very slow to change. And so that's kind of where data ethics comes in to navigate the in-between space. So we have a number of ethic or issues that drive what we do in the field of information ethics, especially AI ethics and data ethics, both of which are kind of subsidiary of information ethics, but it's all the same thing. Semantics not necessary. And so surveillance is a big one, of course, right? In police work, you want to be able to secure and to identify and all the rest, but more and more now we run up against complex technologies that can be used for surveillance, but we need to understand kind of the extent of what those technologies are capable of. And on that note, I'll probably drop a reference a number of times through my quick 10 minutes on from the movie Minority Report, if anybody's seen that. I kind of use that as a guide. And I'll often say in 2002, when that movie was made, it was science fiction. Now it's real life. I think everything that, minus the precog, everything that was done there technologically is now possible. So yeah, surveillance aggregation, especially again with AI, where artificial intelligence is able to aggregate a number of sources that aren't necessarily PI, which is personal private information. So a number of different sources that are anonymized, and yet with that information still re-identify individuals. And so this is a concern both ways, in terms of effective law enforcement, but also in terms of privacy. So then we have disclosure and exposure. I won't go into details about disclosure. That's pretty basic, but exposure is a step above when, that disclosure becomes a harm or psychological or emotional harm to an individual or a group because of what it has exposed about them. And then lastly, in terms of digital divide, this is a huge one too. Accessibility, the right and the ability to know how to access, not just to have. It's not about have and have not. It's about knowledge, the ability to retrieve and then use digital sources. So a quick overview of some of the issues that I deal with. Next slide, please. So here, this is the big one for me, and this is kind of what I wanted to leave, if nothing else, leave this with you at this webinar in terms of trying to do effective police work while running up against privacy legislation. It does happen, you know, and of course we have to respect privacy, but we also have to find that route to safe public safety. So as I mentioned before, ethics is often wrongly confused with morals on one side and then compliance on another. Everywhere I've worked with, whether it's been IEEE, City of Edmonton, what they want is guidelines, data ethics guidelines. And so I'll do that for them. I'll write up 10 guidelines. But the truth is, as soon as you write up guidelines, then that becomes compliance. And you don't need to think about it. There's a rule. You follow the rule. Whereas data ethics, the difference is you have to critically assess a situation using your own capacity, right? And so that's what ethics is. And you can't really encode that in guidelines because you want people to be able to think and to make their choices and to not just follow rules all the time. So again, ethics is that critical bridge that lands between the two. Next slide, please. So yeah, I think just expanding on that, the previous slide, data ethics is often different than compliance, but often works alongside compliance. Data ethics primarily about people and social justice, not actually the data and the technology. And one of the maxims of the field of data ethics or information ethics is that a person is their data or their information. One of the head philosophers of the field of information ethics wrote a book on how we are our information. It's all very high in the sky and interesting, but you know, at a practical level, we have to respect people because they are in fact their information, especially again with AI, as more and more of our person becomes biometric, but it becomes available for information, right? Again, referencing Minority Report, right? You know, your iris, your temperature, your mood, your expressions, you know, cameras can gauge all of these types of things, and then you know, advertise it to you on the go through a feedback loop based on your motion, and then change your perspective based on that. So it's all kind of a science fiction phenomenon that's come true over the last couple of years, and only to become more and more you know, inclusive in our technology. All right, so like I said, yeah, data ethics, it comes down to a personal commitment. It can't be regulated. It can only be taught and learned. Next slide. So often when people ask what I do, I say, well, I break stupid rules. And then once I have their attention, you know, I kind of count down on what that means. So law and policy are there for good reason. They're a common ground that we can all meet on, and thus have equal expectations, right? We're not let down in terms of how we're supposed to interact with the other. So law and policy, often people, you know, as you would know, I think in your field of work, an often common theme is that law and policy are for other people, right? Not for myself. You know, I can break a law, et cetera, and that's why, you know, we ultimately have problems. Expectations are no longer met on all sides. You know, when you're driving and somebody, you know, pulls a bonehead maneuver, you're in shock or in an accident. Why? Because you expected them to, you know, take that left turn properly. So what we do, we work in the background. When I say I break stupid rules, I'm not referring to above where, rules are for other people. What I mean is that we work in the background, advising change in policy and standards when those policies and standards no longer serve the best interests of the people. And this is often the case, like I said before, and I think you'll all agree, law and legislation are slow to change. And sometimes, especially now with technology, they don't cover what needs to be covered. And so police work especially becomes very difficult. Next slide, please. Next slide. So there are a number of challenges, and these challenges were I actually annually present to the Edmonton Fraud Association on fraud, and these 6 challenges are, I got them from, I can't remember now. It was a police agency, kind of like what you guys are doing here, and these are the 6 challenges that they face. The mindset, an organizational culture that understands the value of both access and privacy, data capabilities, so ensuring the right technology and the use of it, data quality, so that reliability and consistency with data can bolster public confidence, right? And public confidence can boast change in legislation. Data ethics, as I've mentioned, and then access. Next slide. So here's the big thing when it comes to what is ethics, right? Whether you're in police work or you're a citizen, you're going to most likely have one or the other of these perspectives. So consequentialist perspective, otherwise known as utilitarianism, most of us know what that is. It's kind of the greatest good for the greatest number of people, and the way that's often interpreted is a means to an end. So at the end result of an investigation is what matters, right? And so we have to get there one way or the other. And, that's where we can get into trouble depending on how we get there. But we want to be able to, critically assess what tools we have and our own creative imagination to get around, to work with the law, even though we have privacy restrictions. We have to be able to figure out how to do the job. The deontological perspective, that's a duty-based ethics principle. So it's kind of a rule. It has to be followed no matter what, right? So it doesn't matter if you catch the bad guy or not. You got to stick with the rules that have been established, whoever may have established those rules. And so the 2 opposite perspectives are sometimes, one or the other used, but they're often in conflict. But if we can realize what those perspectives are, use them together in a particular stance or particular situation, then we have a lot more available to us. So one person's ethics or values may determine their ethical approach to an investigation. Does the end justify the means, or do we have a duty to adhere to established principles and laws? An open question to think about. Next slide. So two theories that are often brought up in fraud investigation, and often when I speak to, and I do work with police, often even with the city in just an advisory capacity. And these 2 theories are important for what we do. The noble cause corruption theory is the idea that inevitable corruption results from constantly justifying the means with an end. So although we may, justify it one time, justify it again, eventually it becomes, habitual, and that's where, a lot of trouble can start. The mosaic theory is the idea that a collection of personal identifiers, even though they're public and free for the access, they can expose an individual over time and, of course, over aggregation. Next slide. Just checking the time here. How long do I have?
You're good so far. You're
Okay,
good.
all right. So using data in policing, as I've alluded to numerous times, it's becoming more and more complex. Not just data, but technology. I've worked with a number of police who they kind of shrug their shoulders and they say, you know, the only means we have to investigating this is combing through social media and internet forums. And that used to surprise me because I just assumed they had a lot more tools in their kit than that, but not always. Real-time notifications and live data, that can help in policing. And then, of course, we get into AI, natural language processing and machine learning. There's a lot that it can do, things we don't even know yet. And as a tool, it's indispensable to police work, to security. And it's important to A, learn how to use it, and B, how to use it responsibly. As I alluded to before with the Minority Report, the growing use of additional biometrics via artificial intelligence, this is a real thing now. And it's a very valuable tool, but also a very invasive tool. Can we find a balance? Can we find a balance in legislation and ultimately in public perceptions and expectations, right? Predictive policing and pre-science, this is directly from Minority Report. We may not quite be there yet, but we will be soon enough. At least predictive policing, using AI to draw up psychological profiles, using numerous sources that we ourselves as humans couldn't even imagine using. So ultimately, there is a growing gap between regulation and the scope creep of new database technology. So for those of you who don't know what scope creep is, it's just when a technology or a data set is used for one project or one purpose, the expectation is that it's used for that project and that purpose. However, because that data is now available, it can start to be used for other projects where the subject may not have given permission, and so on and so on. And the problem with AI is that AI automatically scope creeps. That's the nature of what AI does. And so we have to be careful of data in terms of the tools we use, because we want to be able to use that tool, and yet we want to be able to control what AI does with it. And that is, you know, a very complex situation, growing more complex every day. Next slide. So the concerns, evidence and bias in social mining continues to arise, and that's not just in human use, but in AI. Evidence of prejudice in surveillance and investigative efforts, either because of human error, human bias. We all have bias. We all come from our own bias perspectives, and we have to recognize what our bias is. That's hard to do. But imagine how much more difficult it is when we start to program AI to emulate us. Well, we're programming it with our own bias, and therefore AI, it doesn't create its own bias. It has our own bias put into it. So yeah, the concern of scope creep, aggregated databases are being created, which is good, right? And this is, I know this is so important for you guys and so important for police work in general, is to share knowledge and to be able to have access to databases. You know, but oftentimes, if we're not careful, the tools we use, they can exceed scope creep and become not just a detriment to privacy for individuals, but security risk sometimes. The concern of the chilling effect. This is a political thing, more or less, where if a person feels self-censored for whatever reason, then they're not going to exercise their autonomy and their political rights. They're going to feel, you know, kind of controlled. And so we have to also, in our work, make sure that people feel and know that they have the privacy to maintain autonomy, the privacy to be able to get involved in politics safely and equitably. Next slide. So I think this is, I think, a lot of what I've already talked about. So facial recognition technology, biometrics, we have the GDPR kind of to look at, as well as, you know, our Canadian standards. And then so the whole globalization of the use of technology and the legislation that goes with it, that's becoming complex too. So yeah, there's a disconnect growing. This is a huge disconnect growing between the public expectation of what our privacy is and what it should be, and then what it actually is based on, growing ability to use different tools. And so from my perspective, police need these tools. We need to be able to do the job, but at the same time, we need to, I think, educate. We need to be able to inform the public without undermining police work, but to inform the public of what these tools are capable of and how we're safeguarding public. Because if that expectation keeps dividing, a further divide between that, then we have distrust in society and distrust in the public, and then our legislation becomes more restrictive. And so there's kind of a balance there. So the predictive analytics ability of AI to analyze patterns that can predict fraud or other crimes, this is a wonderful ability that we have coming. We may not be there yet, but pretty soon we're going to have all sorts of abilities to do that. But as I've mentioned, that can become, that can become go into overdrive, so to speak, and before we know it, we don't have control over privacy or kind of the use of these predictive analytics. So what are the ethics of acting on predictions of fraud? Again, Minority Report, I've quoted there. The creation of complete psychological profiles of individuals is no longer science fiction. It's fact. Okay, next slide. I think I'm actually at time, am I not?
Yeah, if you can, Jared, thank you. Yeah, you're just wrap up for us there. I'll give you a chance there, though, to finish up.
Yeah, let's just, if you can click, John, to the last slide. There's a couple more, I think. Keep going. Keep going. Keep going. Keep going. Okay, right here. So, yeah, I mean, in conclusion, it's important to recognize and understand the power and scope of data, not just on the impact of individuals and on individual privacy, but on the abilities that technology and data and information have. As Chief Johnson mentioned right at the beginning, police work is built on information. And so now more and more we have a responsibility to it and a need to become educated about the ever-increasing tools that are available through it. So provide tools and legislations to support ethical data use, counter crime, and do the job. But we need to implement legislation that provides investigators better access to data services. Sharing in a responsible way, of course, common sense stuff, and establishing common and transparent standards and expectations system-wide for dealing with crime and privacy and expectations of privacy. And I will leave it there.
Excellent, thank you, Jared. I have just been jotting things down. I have a whole bunch of questions, but and I would ask anyone else in the group, please, if you can add them in the chat at the end. We'll go to every the audience's question first. Lots to think about there, Jared. Excellent. So we're going to keep going. Yeah, I'll introduce Michael Billinger. Michael's currently a manager in the RCMP's National Technology Onboarding Program, where he is responsible for transparency and outreach. Prior to joining the RCMP in 2022, he spent 12 years as an investigator at the Office of Privacy Commissioner of Canada, where he has led a number of high-profile and precedent-setting investigations, including the RCMP's use of Clearview AI facial recognition technology and cell site simulators, which had national repercussions. Michael started his career in public service at the Edmonton Police Service, where he was a manager of the Freedom of Information and Protection and Privacy Unit. He has a PhD in anthropology from the University of Alberta and has worked on a number of forensic cases in addition to his privacy-related duties. He is also a past member of Ontario's Death Investigation Oversight Council. Michael, I'll hand it right over to you.
Great, thank you very much, Chief. John, if you wouldn't mind putting up the presentation. So my presentation is going to be a little more simple than Jared's, a little less conceptual and a little more data-driven, but you'll see that in the end, we kind of end up in the same place. So that's encouraging, I think. So I'm going to speak to some research that I conducted when I was with the Edmonton Police Service in 2010. Although that was quite a long time ago now, I believe that the trends that interested me back then remain basically the same today. So freedom of information and protection of privacy laws are often seen by members of the law enforcement community as obstructing their basic mandate of maintaining public order and ensuring public safety and security. These laws are seen as mechanisms for criminals to obtain free access to police information, while at the same time, they create significant barriers to collecting information for investigative purposes from other law enforcement agencies, government departments, and businesses. So I'm going to argue that police services need to focus on accountability and transparency while improving information sharing between agencies, all of which are essential components of community policing. Next slide, please, John. So I want to talk specifically about Edmonton in order to set the context here. Not to discriminate against Calgary, but I did conduct research specifically on Edmonton, and I think Calgary followed similar patterns. So they should be analogous. I will talk about Calgary a little bit as we move through it, but just in terms of the numbers that we see when looking at data. So the Edmonton Police Service, or EPS, was an early adopter of community policing and the philosophy of community policing in Canada in the late 1980s. Community policing initiatives were expected to lead to a measurable reduction in the fear of victimization, actual victimization, and complaints against police officers. Well, it's generally recognized that there are 5 primary traits of community policing. I want to focus on 3 essential elements. The first one being crime prevention and the creation of a better quality of life for citizens. The second being proactive policing, involving problem solving rather than responding case by case. And the third being offering community service as much as law enforcement in collaboration with community organizations and other government agencies and services. So by the early 1990s, the EPS was faced with a dramatic increase in calls for service, while at the same time, it suffered from a 50% reduction in funding from the provincial government. The EPS was forced to develop innovative strategies to deal with these problems, centered around the notion of bringing police closer to the citizens. This is a particular problem in a city like Edmonton, with the boom bust cycles, with the petrochemical industry in Alberta. Interesting political times now, but certainly back in the 1990s, back when I was a teenager, it was also quite interesting across the country. Oh, by the way, I'm speaking to you from Ottawa this afternoon. I didn't already mention that, so I'm pleased to be with. I see a large contribution here from Alberta, but also from Barrie and other places. So pleased to see everyone here. Okay, back to the topic. This led to the creation of community police stations scattered throughout Edmonton and a focus on neighborhood foot patrols with the goal of increasing positive interactions between the police and community members, particularly in the most problematic neighborhoods. By all accounts, this approach worked very well in Edmonton. Several studies showed increased satisfaction with the EPS based on such things as the perceived efficiency of the police service, visibility and availability of the police, confidence in the quality of follow-up, and the quality of crime prevention programs. Police officers also reported being significantly more satisfied with their work, citing communication and collaboration with citizens as being some of the most fulfilling aspects of their jobs. I think that's really important. That's a really important point to focus on. Next slide, please. As I mentioned, the 1990s, especially the early 90s, were pretty wild times, but politically, there was a shift towards what I call the democratization of government information. It's the appreciation, as Jared hit on, is that information is actually about people. The government doesn't own the information. The people own the information. It is theirs. So what started on the federal level with the enactment of the Privacy Act and the Access to Information Act in 1983 very slowly spread out across the country. I put Ontario in here just for comparison. But what you see in the federal context is a split between privacy and access to information that does not occur in the provinces and territories. Ontario, Alberta, and in fact, if I'm not mistaken, all of the provinces and territories have combined legislation that puts together access to information, or as they call it, freedom of information in provinces and territories, and privacy together, which creates a really interesting context. So what I'm going to suggest is that in 2000, with the enactment of PIPEDA, the Personal Information Protection of Electronic Documents Act, which applies to private sector companies that have a national presence, so telecommunications providers, for example. And in 1995, in Alberta specifically, we have the enactment of the FOIP Act, which applied only to provincial government organizations. But in 1999, it was amended to include local public bodies, as they're called in the Act, which are municipal agencies, including police services. This changed the game quite a lot. Also 2000, the enactment of the Health Information Act. So I got to speak to all of these things. Next slide, please. So I want to discuss what I'm going to call the FOIP effect in Alberta. So if you look at the data on the screen here, although the greatest number of FOIP requests were made to healthcare bodies between 1999 and 2000, which is before the Health Information Act came into force. So clearly people were interested in what was going on with those healthcare providers. And this was the only mechanism to get formal access to information before the Health Information Act came in. The overall number of FOIP requests made to police services in Alberta has dramatically increased year over year since 1999, accounting for 45% of the total number of FOIP requests made to local public bodies in Alberta between 1999 and 2008, and well more than half of all requests made in 2007 and 2008. So when I say police services in Alberta, I'm referring specifically to EPS and Calgary Police Service combined, only 2 police services. Interestingly, in 2007 and 2008, FOIP requests to police services accounted for nearly 20% of all FOIP requests made in Alberta to provincial government and municipal agencies combined. Next slide, John. So in order to understand what this means, we need to look at what types of requests are being made. So if we look at what people were requesting in 2007 and 2008, we can see that about 90% of the requests received by police services in Alberta were requests for personal information. So we see 2007, 71 requests for general information, 779 for personal information. That general information is about police operations. It's the sort of bureaucratic information. How does the organization operate? The personal information requests are information about me, about myself. That's what everyone is entitled to under the Act. I mean, in reality, people are requesting information about their neighbors and their ex-spouses, new friends and things like that, which they might not necessarily be entitled to. But it's the personal information that seems to be really at issue. And what I think this clearly demonstrates is that Albertans are both keenly and increasingly interested in knowing what sorts of personal information are being held by police services and how that information is being used. In my experience, the vast majority of personal information requests made to police are because the individuals involved in an incident have not been adequately informed of the progress or result of the investigation. There is a percentage in there that, it's kind of I don't know how to say it, but one of the things that these acts were not created to facilitate access to personal information for employment purposes. One bad trend that everybody in the business has seen over many years is that FOIP, or access to information, has become a substitute for adequately dealing with HR issues. And we have employees making requests for their own information. So when I was at the EPS, I dealt with a number of requests from EPS members who were seeking information about professional standards investigations that they were involved in. It was the only way in which they could get information from their employers. So that's a bit of an aside, but it's something to factor in, that when I'm going to suggest that privacy is creating a tension between the police and the public. It's also creating a tension between employers and employees. So that just an aside. Next slide, please, John. So that's old data. How do these trends play out today? So data from 2022 and 2023 show that overall, The number of requests to municipal agencies continues to increase year over year, and that police services in Alberta continue to be overrepresented in the number of FOIP requests received. You can see from the data on the screen that the EPS and CPS received about 68% of all personal information requests made to municipal agencies in 2022 and 2023. When you look at the data from 2018 to 2023, you see this continuous rise in the number of requests. There's a little dip in 2019, 2020, but the trend in the increase in personal information requests continues to go up. You can see on the far right that compared to local governments, and you can imagine there's a lot of information that local governments hold, and there's a lot of different local governments that fall into that category. The request to police services, and they've added in also the police commissions as well, who don't receive a huge amount of requests, but it far outnumbers any other municipal organizations combined. Interesting trend. I don't really know the answer to it, but you see that the general requests at the EPS has gone up to well over 1,000, whereas the Calgary Police Service has 360. I haven't worked at the EPS for quite some time, but I imagine they've changed something in the way in which certain types of information can be accessed by individuals, which is requiring them to put in a FOIP request, whereas they may have been able to get routine access to it before. Not all that important though. Just it does. I think this clearly demonstrates the trend that I showed back from 1999 to 2008. It just continues this upward trend. Everybody knows, whether it's here in Ottawa or out in Edmonton, is that the number of access requests is always increasing. Those of us that have worked in regulatory or compliance know that the complaints about non-compliance continue to increase and the resources continue to remain the same. So big problems. So what does all this mean? The extremely high number of FOIP requests for personal information received by police services in Alberta, in my opinion, signifies that the FOIP Act has created a communication barrier between police and citizens, which is detrimental to community policing initiatives. There's a lot of other societal changes that feed into this. Clearly I'm simplifying. Back when I did this research in 2010, not everybody was putting their phone in police officers' faces, but there's a reason why they're doing that and doing that now, and why this is being so widely shared on the internet. So this is not to say that the FOIP Act itself has created this barrier, but rather it is symptomatic of the complexity of privacy law and access law. Where the quality of follow-up on citizen complaints was once the cornerstone of community policing, police members fear the repercussions associated with privacy breaches, even if inadvertent. It could go from being a code of conduct issue, they could be fined, they could face civil litigation. There's a number of different penalties, even if they just slip up in good faith. Additionally, sharing information between police services and government institutions, which is an essential part of intelligence-led policing, is becoming more and more complicated. It may be even more difficult when police attempt to obtain information from businesses such as utility companies, telecoms, or banks, which may be reluctant to provide information without a warrant or production order, even when the information being sought is critical to the investigation of a serious crime. In the mid-2000s, police in Alberta were also experiencing significant difficulties in obtaining information from hospitals and other health service providers for investigative purposes, despite there being clear provisions in the Health Information Act allowing for it. In order to alleviate some of these issues, amendments to the Emergency Health Services Act came into force in 2009, and the Gunshot and Stab Wound Mandatory Disclosure Act came into force in 2010. These are appropriate remedies. These are the sorts of things that we need. These laws these acts have very clear titles to them that spell out exactly the circumstances under which the disclosure of personal information is permissible. That's very important. So I just want to make a point. There's actually 3 points to this that I see coming out of my experience and out of the data analysis that I've provided. One is A, it's essential that police services have trained professionals who are responsible for ensuring that all of their members are aware of their responsibilities in terms of compliance with privacy laws, and who can give rapid and practical advice to those members. B, it is essential that public engagement and transparency be a focus for all police services in Canada. And C, it is essential that police leaders advocate for laws that give clear legal authority to share information with police where it relates to a lawful investigation. So in our context here in Ottawa, the federal government, we've had these laws in place since 1983. There are very few people, and I don't want to say anything discriminatory against some of my great colleagues, but there are very few people here who have the experience to know how to apply the law in a way that is effective, in a way that manages organizational risk, and in a way that gives members clear and concise answers when they're in an urgent or exigent circumstance. That's really what we need. There are some great programs across the country. The University of Alberta has one, Access and Privacy. We need more and more trained people because we have members out there that have no idea how to interpret privacy laws, and they're letting it hold them back. They don't feel open to engage with the public. They cannot go and say to somebody who was involved in a neighbor's dispute, you know, I just want to follow up and let you know that we've investigated and you know, we haven't laid charges against your neighbor for these reasons. That should be fundamental to basic follow-up on a investigation, but it's simply not happening on the ground because of this fear of saying something about that neighbor and facing a privacy complaint. And one final point is that something that I dealt with here at the RCMP a while ago is the fact that we are not, in many cases, providing sufficient information to victims of crime, even though it's very clear in the Canadian Victim Bill of Rights that we need to assist these people and provide them with the information that they need. So the professionals that are responsible for access and privacy need to understand how all of these different bills come into play, and they need to take risks. There's very little, what I mean by that is there's very little jurisprudence on access and privacy law in general. And for example, when you're releasing information about somebody who's deceased, I've always said your risk of getting a complaint is quite low. So think about the benefits of the release of information. It does not mean go and breach everyone's privacy, but there are clear benefits to other individuals in the release of certain types of information, particularly when it will help them to resolve issues around the administration of an estate. So, you know, let's help people out. That's our goal. So I'll leave it at that. Thank you very much.
Excellent. Thank you, Michael. Lots to think about there again as well. Appreciating that. Andy wasn't shaking his head in just confusion because that was a lot of provincial aspects. So each province a little different with some federal overlap there. So as you can imagine, Andy, in conversations we've had, and I do love Michael's point with respect to, you know, that frontline officer, how much do they know and what are they able to share? And that goes right over into how each police organization deal with their own members. That's not the topic of today, but in terms of organizational stress and what are the repercussions of a well-intentioned sharing of information with repercussions that may have breached an act. So lots to think about there, Michael. Thank you. I asked everyone any questions for Michael, please put it in the chat. And I want to jump right over to Ewan, respecting everyone's time. So Ewan Affleck has worked and lived in Northern Canada since 1992. He is currently serving as the Senior Medical Advisor, Health Informatics, College of Physicians and Surgeons of Alberta, Strategic Advisor, Clinical and Informatics, at the Canadian Institute for Health Information, and Chair of the Alberta Virtual Care Working Group. He is the past Medical Information Officer of the Northwest Territories, was co-chair of the National Virtual Care Task Force, served on the expert working group of the Pan-Canadian Health Data Strategy, and is the executive producer and co-writer of The Unforgotten from 2021, an award-winning film about the inequities in health services for Indigenous people living in Canada. In 2013, he was appointed to the Order of Canada for his contribution to Northern healthcare. So I'm going to hand it over to you, Ewan, a different angle to this conversation. Please go ahead.
Thank you very much. And it's a bit of an unusual group. I don't usually hang out in this domain, so it's quite fascinating. Thank you kindly. I will share my slides here in a moment, but I just want to say that yes, I will talk about health data and as it relates to privacy. But I see many parallels here that are quite fascinating. So thank you for inviting me, and I will share my screen, and you guys can confirm. Do you see this health data disarray? Someone could say yes.
Not yet.
Not yet. Okay, share entire screen. Here we go. You see it?
Yeah, it's good.
Okay, so I'll get started here. Again, thank you very much. I'm a physician. I still work, provide acute care services in the Northwest Territories. I sort of go between Alberta, BC, and the Northwest Territories. But I spend most of my time working with health data and in the domain of health data, public policy, and governance. I'm just going to, what is health data? I mean, it's the essential ingredient of all decisions in healthcare, much like yourselves in the policing domain. Every single decision a physician, nurse makes, a researcher, a health innovator, management, so forth and so on, population, public health, we require information and we adjudicate that information in order to make informed decisions about someone's care. So if you're missing information, if you don't have it, or if it lacks quality or integrity, then this can have bad outcomes. So I'm going to just first frame this a little bit of bad news about where we're at in Canada. Where do we stand with respect to other nations? So this is a little article from the British Medical Association journal from 2023, and basically said that the picture that emerges with respect to data is that we're an ill-prepared country with outdated data systems, poor coordination, cohesion, and blindness to the citizens' diverse needs. This is from RAND Europe, which is a think tank. There's also a RAND United States. And they concluded in 2022 that we suffer from a lack of integration, standardization, and interoperability of the technical infrastructure. So we have this profoundly fragmented data. They went on to conclude that they believe this is costing Canada about $6 billion a year. What are we saying about ourselves? This is from the Council of Academics, and they suggested a year and a half ago that although we've worked for decades to improve the collection and use of health data, we've largely failed. Data is not shared well across organizations, regions, boundaries, jurisdictional boundaries. It's a bit of a mess. This is the Pan-Canadian Health Data Strategy. I was a member of this, but we established that at extreme there's a risk of irreparable fragmentation of health data that is harming individuals, communities, the healthcare system, and eroding our essential values around the importance of the healthcare system. And lastly, this is the Canadian Public Policy Forum, a think tank. And basically they concluded a year and a half ago that we're lagging behind other nations in our use of health data and sounded the alarm about our subpar performance. And acknowledged again, as I said at the outset, that data is the vital currency of any digital age system. I could go on. There's so many studies showing this. And this is really finally coming to the fore about how dysfunctional we are in Canada with respect to health data. And again, it's the currency. If you're a baker, you need flour. We need information. If you're missing lab results, you're missing allergies, things like that, things can really go south quickly. So my group and I, we're a community-based group, and we produce basically evaluations of the Canadian health data system, really with a focus on Alberta. And we put out a report a few years ago called Interoperability Saves Lives. What we concluded is that the fragmentation of health data is leading to the harm of Canadians in the healthcare system. And we proposed something called the Health Data Related Harm Framework. And the Health Data Related Harm Framework, I'll just go back, is basically a framework that suggests 9 forms of harm arising from health data, privacy being one of them. And I'll get into that in a moment. And this is a big problem. I mentioned the $6 billion that RAND Europe suggests it's costing us. There's a study coming out from CIHI, Canadian Institute for Health Information, soon that suggests it's $9.4 billion. Canada Health Infoway, an arm's length federal health information system agency, suggests it's $2.6 billion. Anyway, you can choose your billion, as I state there. This is a huge problem. So we put out another report last year following up on Interoperability Saves Lives. It's called Data Disarray. And we did an evaluation of public policy. How do we as Canadians, both on a federal and jurisdictional level, address the coherent use of health data? And basically what became very clear in evaluating public policy is no one's in charge. There is no strategic plan for the use of health data. Yeah, it's like having a hockey team, the Edmonton Oilers, without a coach, or running anything without any strategic or operational oversight. It's just a series of random things that are happening. And I'll get into this specifically because we'll look at the Health Information Act that was referred to, the Alberta Health Information Act, in a moment. So that's what our most recent report, which we released a few weeks ago, is disconnected care. And it's basically, we evaluate the impact of the Health Information Act on the health and well-being of Albertans. And we did a comparative analysis to other health information acts in Canada. What we concluded is that this act is legislating the harm of Albertans, and most health information acts now are legislating the harm of Canadians. And I'll explain why. It's a fairly strident claim, but I think it's fairly evident. So this is the harm framework that I referred to. And there are 9 forms of harm and we are actually just working with a group at Mount Sinai Hospital in New York City to validate this framework. And coming out with a whole report on that. But the forms of harm arising from the use of health data, and this was referred to, some of the previous speakers referred to the importance of not breaching public trust. And often when we talk about public trust with the use of data, where people refer to, we don't want to breach their information. And what's odd in the healthcare system is we don't ever really consider, maybe we're breaching their trust by not using the information coherently to ensure their health and well-being is preserved. So the forms of harm are damage to physical and emotional well-being if we don't use data or have access to it, or it lacks integrity, breaches of privacy and security, failure to optimize health system efficiency. I made reference to the billions of dollars we appear to be wasting. Failure to support the health and well-being of the workforce. There is currently a large amount of literature pointing to health information systems, dysfunctional systems, as a significant contributor to burnout on the part of the health workforce. And if you guys are probably hearing in the news, but burnout is a huge issue right now, and there's a lot of attrition from the health workforce. Failure to support innovation, irresponsible or socially harmful use of data, using health data for corporate ends without social license, for purposes of discrimination, failure to use population-based data for public good, research, population health, failure to uphold cultural rights to health data like Indigenous data sovereignty, and failure to uphold people's legal and ethical rights. As someone mentioned that, this data really belongs to each of us. It's the same for health data. Supreme Court of Canada established in 1992 that that health information is ours, each of ours. And yet in Canada right now, only 39% of Canadians have access to some of their information digitally. So the Alberta Health Information Act addresses two issues: breach of health data privacy and security, and it upholds the right of people to access their data. All the other forms of harm are not addressed. And one could say, well, maybe they're addressed elsewhere, but in fact, they're not. They're not addressed anywhere. So I'll go through just a few of the findings in this report about the Health Information Act, Alberta. And these findings really apply to most health information acts in Canada, although Quebec has just tabled a new act that is really more forward-thinking probably than any others. So the Health Information Act fails to align any regulatory approach to the foundational accountability to foster quality health programs and services. So does it say that while it's ensuring privacy of information, does it do so in a manner that doesn't potentially damage people? It doesn't actually really consider this at all. And in doing so violates the spirit and intent of the Canada Health Act. Mitigation of health data related harm. So I mentioned all these forms of harm. The HIA only addresses two and does not address any of the others. All the other seven forms of harm are either passively referenced or not referenced at all. Up-to-date digital technology, the Health Information Act largely does not consider virtualized services, cloud-based information sharing, advanced analytics, AI, home monitoring, mobile health tech modalities. It does reference, it was amended, it's been amended 20 times, and it was first tabled in 24 years ago, or 25 years ago, I think now. But it largely is analog policy in a digital age. And it uses a custodial model, and I won't go into this in great detail, but it basically successfully says each custodian, which are identified, they're physicians or health services like hospitals and clinics and so forth, the government, each one is responsible for procuring technologies and ensuring the safety and security, or the security and privacy of the information that they gather and hold. But in no way do any of them have to interoperate in any way. So in doing so, what it does is it successfully fragments health data. So all of our information then becomes fragmented between the different health services or different custodians that we see. And in doing so, as we've established, the fragmentation of our information actually leads to harm to us. And so in doing so, that's why we sort of conclude that overall this is leading to more harm than good. And in stating all of this, we deeply defend the importance of the mitigation and control of any issues around privacy and security, but not at the expense of damaging people. But unfortunately, that's sort of what's happening now. So we promote a stewardship model of health data, which is beginning to happen around the world, and that the custodial model should be abandoned. I'll sort of blow through this stuff, but yeah, it impairs teamwork, burnout I mentioned. And this was referred to also, that the variable interpretation of the HIA by different custodians is leading to all kinds of obstruction of data flow and increased administrative burden and burnout in turn. And lastly, as was referred to, there are three privacy there are three different legislation or acts in Alberta. They are not harmonized. And in fact, health professionals, depending on what category they are subject to different ones. And in fact, where they may work on a given day, a psychologist or a physiotherapist who is not a custodian, if they're working for a custodian, is subject to HIA. If they then go back to their private clinic, they're subject to PIPA. And if they go to, let's say, an educational institution like a university, they'll be subject to 4th. That can all be in the same day, and they can be dealing with the same patient, but subject to 3 different laws. And lastly, there's no portability of information. There's no portability of any of this legislation. Basically, despite the fact that portability in the Canada Health Act is mandated and is a condition of funding for provinces and territories, the information we require to ensure the portability of care is not. And there's a report coming out on March 12th that I co-wrote with Health Canada, that we collect narratives about the damage being done to people because of this, using the harm framework. So, and this really speaks to this is something we put out, interprovincial trade barriers. This is sort of an interesting slide on the tariff day today, but interprovincial trade barriers to health information are costing money and lives. So we have antiquated and absence health data governance and public policy. It is making data sick, and this is harming Canadians and Albertans. And so really, we feel we're legislating the harm of Canadians. We are hindering the function of the health workforce and promoting burnout. We are legislating the damage of the healthcare system to the tune of billions of dollars, and we are hindering digital health innovation. Frankly, we're violating the core purpose of Canadian healthcare. The last time I checked, the purpose of health data was to be used to promote the health and well-being of Canadians. And yet in no way legislatively do we assure that. And this is news to most people. I think they have no clue what is going on inside the system. This is easy to solve because this public policy is a human construct, but we just need to cooperate in order to do that, and we will all benefit. So I will stop there and turn it back to you. And I don't know, if this has relevance to policing as such, but this is what you wanted me to talk about. So
it certainly does. It certainly does. Thank you for that, and appreciating. I was just looking through some of the comments of some of our audience, and it's a fair point. I think Michael had mentioned, that's the officers, or from a policing perspective, those operational people. I push paper for a living, but for the people who actually work, when they're out there, they need that timely and immediate information. And Michael's point that, they should have that available. But to your point, and I can't even imagine what Andy's thinking at this point, for Alberta, 3 different acts, not harmonized. And on some days, it depends on what role you're acting in. And the expectation from a police perspective, when you're attending calls and there's some challenges, like what legislation applies in different and depending upon the roles that the officer may be dealing with certain information. I just think there's a level of complexity there that I think other nations may have found better ways forward, or a simplified fashion. Not better or worse, perhaps just more simplified. And then its application or use might be a little more streamlined. Is there a particular country that you would recommend, a model that we may adopt?
Is that directed to me?
Yes, it is. Absolutely.
Yeah. Andy, the United States has legislated interoperability. You're struggling with it on a regulatory basis, health data. 20 years ago, this process started. We are grappling with considering this now. Denmark did it 40 years ago. Denmark probably would be a country that I would suggest is well in advance, but just about everyone is compared to Canada. We are victims of confederation here and this fragmented approach. And confederation and this union of all the different provinces is lovely, but in a digitized environment where the capacity of the network effect can really benefit people's health, it doesn't work. And the last thing I will just say is, Nancy asked, what's the good news? The good news is sorry, I should have got to that. I sort of borrowed some slides. The good news is there is interest, unprecedented interest by the federal government and by many groups in this issue like I have never seen, and I've been working in this space for 30 years. This was ignored until COVID, when it suddenly dawned on people what a disaster this is in Canada, and you saw some of the references. So we have finally begun to wake up. That's the good news.
Excellent. Thank you for that. And John, if I could just get you to monitor the in-chat conversations. I'm on an iPad, so it's not ideal. I did want to speak quickly to just some of the challenges that Michael had brought up. So we're talking, and you spoke about health specifically, and Michael's when we were talking about policing access to information and sharing between agencies. When I was speaking initially about the DICE model or bringing multiple agencies together, you're just talking about health within health. But there's a great article that I had read in a journal out of the UK about getting access to even paramedic, run transport data and how it can help police, but actually help people. The problem we have is between agencies, between social services, sometimes people fall into the justice sector or cycle as a result of just a whole bunch of things, whereas they probably are better addressed through a health or other social service. And I don't know for any of our speakers, is there a way forward where, and I know Jared had spoke to societal expectations versus privacy. I mean, there's the Millsian utilitarian aspect of, we can't always say the ends justify the means, but is there no balance in there where we need to share data for the health of our society and our community members? Because arguably, if we're not going to share data, how are we going to learn from each other in terms of who needs what help by which agency? And I don't know how to do it. My question is, again, 3 experts here. How do we do that? Anybody?
Well, Rich, actually, that leads into a question Mike posted a little bit earlier. Mike Federico asks, the role of police services in setting public policy. Are we or should we be advisor or advocate or author?
Excellent. I'll offer it up to any of the speakers. Does anyone want to wade into that mess? And I don't mean that in a negative, just because it's complex, right? So anyone?
Sorry, can you repeat the question one more time?
Well,
or not? Yeah, the question.
The role of police services in setting public policy, are we or should we be advisor or advocate or author?
I think real quick, and then I'll turn it over to people that they're talking about. What we commonly see, like in the DICE format, that basically getting multiple seats at the table to collaborate and coordinate, is police tend to be the leaders there. Whether or not they're the doers, I think part of it is the mindset that many police leaders have of let's get this done. I think the other part is a lot of the time police have some of the best data out there and they have the analytical capacity to talk about their data, whereas many other services do not. So they can at least start the conversation. And I'll stop there.
Go ahead.
Michael?
Yeah, in my personal opinion, this is like having worked for a regulator for several years, is one of the reasons why I no longer work for a regulator and I work for a police service is because I found it a little bit tiring to always be telling the police what they should be doing instead of going to seek from them information about what they need to do. So if you look in the chat here, you'll see a comment from John Robin. I'm very pleased to see him on this call because he's somebody who, in my mind, is one of those figures in an organization, a huge organization like the RCMP, that, as was mentioned in the introduction to my talk, that I investigated the RCMP's use of cell site simulators. John Robin, I believe, was the superintendent at that time, and himself and Jeff Adam, who went on to become assistant commissioner, they both took it upon themselves to make public disclosures of information about the use of cell site simulators when every other police service said we're neither going to confirm nor deny. These people really embodied what is accountability, and that's important. So there's really progressive things happening in police services. So the regulators need to stop focusing on what they think are police. There's this real concern about police overreach and surveillance society and all of these things. in reality, at least from what I've seen, it doesn't really exist. We need to be having rational conversations between regulators and policymakers and legislators, and what the police are doing and what are the controls that they have in place to make sure that they're not overstepping. Because in fact, we spend all day, every day talking about controls and developing internal policies that help us to comply with public policies and laws.
Excellent. Thank you for that. Yes, and appreciating, and Michael, you know very well and good, audit is something that the police have lots of and oversight, and we're not at 1984 and that, but certainly from a policing or a public agency type perspective, I can read a newspaper online and, I might be looking at a type of running shoe, and the next thing I know, I'm bombarded with ads. Who's being held accountable? The police are always, as we should be. And I think that's incredibly important because we want to maintain our legitimacy. So thank you for that.